Hello and welcome. My name is Mary Jo Heflin. I'm the ORS Education Manager. This webinar, Best Foot Forward, Writing a Compelling ORS Abstract, is sponsored by the ORS New Investigator Mentoring Committee. If you have any questions following the viewing of this presentation, please send them to ors@ors.org. Speaking today are Dr. Lou Seslowski and Dr. Tamara Alliston. To begin the webinar, I would like to welcome Dr. Seslowski. Dr. Seslowski is the Fairhill Professor of Orthopedic Surgery and Professor of Bioengineering at the University of Pennsylvania. His outstanding research on the fundamental mechanisms of tendon and ligament injury, healing, repair, and regeneration has been recognized with numerous awards, including the American Academy of Orthopedic Surgeons Kappa Delta and Donor Vaughan Award. In addition to his scientific leadership, the New Investigator Mentoring Committee is especially pleased to introduce Dr. Seslowski because of his dedication to mentorship. He has mentored several trainees and serves as a faculty member of the New Investigators Mentoring Workshop and a mentor at the ORS annual meeting. He has guided many trainees through the abstracts writing process, with many selected for oral presentations or as a New Investigator Research Award finalist. Through his long-standing service to the ORS, particularly as a topic chair for the ORS annual meeting and as a regular reviewer, he has unique insight on the qualities of an outstanding abstract. Insight he will share with us today. Thank you for joining us, Dr. Seslowski.
Okay, it's my pleasure. Thank you very much. I'd like to summarize this one slide, describes what we'll be talking about today. I'll be talking about critical elements of a successful and clear abstract. What are the qualities of outstanding abstracts, common reasons abstracts are rejected, and how to avoid them. And then I'll pass the microphone over to Dr. Alliston, who will review a recent award-winning ORS abstract and then provide information regarding the abstract format, submission, and review process. So first of all, what are the goals of an ORS abstract? Primarily, they're to communicate your research to the scientific community. Importantly, to attract an audience, whether it's a podium or a poster presentation to your work. This allows you to establish a record of your accomplishment, convey technical detail and results, and to place your work within its scientific context, and as well as to communicate the clinical implications of your work. So what are the qualities of an outstanding abstract to the ORS? First of all, it's the research. It's an important and timely research question based on compelling data. The methods must be clear. There must be a clearly stated hypothesis, and your study must clearly address or answer that stated hypothesis. The presentation should be well organized, written text, attractive figures, polished, and of course should be proofread carefully for a professional presentation. So step one, outstanding research. There's no substitute for performing outstanding research. So it's important to think about how to perform outstanding research, and it starts with choosing an important research topic prior to initiation of any study. Additionally, it's important to choose high-impact research questions. Any research question can be studied. You may as well study high-impact questions. Perform rigorous methods and think about how to choose those rigorous methods prior to initiation of the study. Ensure that you have sufficient resources, time, money, personnel, prior to the initiation of the study. You don't want to get partway through the study and realize you don't have enough funding or time to complete the study. Ask colleagues about your ideas, again, prior to the initiation of the study. Perform a new thorough literature review prior to initiation of the study. You may have performed a review of the literature a year ago, 6 months ago, or even a month ago. But before you're ready to start, do that lit search again. Make sure nothing else has been done. Read the primary literature, not just reviews, articles, or book chapters. It's important that you go back and read the original literature again prior to initiation of the study. Consult a statistician, again, prior to the initiation of the study. It's too late to talk to a statistician afterwards, and it's important in terms of study design and making sure your study is sufficiently designed and powered. Again, you'd hate to get halfway through the study or toward the end of the study, or what you think is the end of the study, and find out that you don't have sufficient sample size available to do the study in a rigorous way. And one good trick is to outline the study design and even the expected results prior to the initiation of the study. If you outline what you expect to find or what you need to find to address your research question, that may help you make sure that your study design is right, that you'll be able to gather the type of data so that you can report the results that you're looking to report. Note that there's a lot to do prior to starting the study, and if you spend enough time on the front end, you have a better chance at being successful when it comes to abstract time. It's important to know your message. Think about and discuss with your colleagues what your data means, how one might interpret it. Make sure you have a clear hypothesis and a conclusion that conveys the main idea of your work. It's important to realize the hypothesis of the abstract may not be identical to the one you set out to answer. The study that you set out to answer may be a broad, comprehensive study, whereas the study you're presenting in the abstract may be one focused aspect. It's important the conclusion matches and addresses very directly the research hypothesis or question that you put forth. And then the rest of the abstract really just supports this primary message. Your presentation. There's a standard and conventional structure that these abstracts should follow. And this structure will not only help you putting the abstract together, but it will also help the reviewers in finding information they're looking for as they're reviewing it, and ultimately the reader and the audience to understand the work you've done. These areas are introduction, methods, results, discussion, and significance. And if you take advantage of this structure, you'll likely communicate your message more clear. It's important to start early, get in print for others, and proofread again for a professional presentation. So let's start with the introduction. The introduction to an ORS abstract is typically just a handful of sentences. It first establishes the importance of the subject, explain what's known about the subject, what's unknown, what's the holes in the knowledge, what's problematic with the known, what are the weaknesses here, and then go forward and address those things. If there are key terms you need to address, that's fine. And then conclude the introduction with a clear statement of the research objective, questions, and hypotheses. And that should have been directly set up by the handful of sentences before that. Do not take time in the introduction to provide a review of the field. Stay focused. Prevent a focused rationale that leads directly to the stated hypothesis that this study will address. Materials and methods. Start with what was used, what did you study, the demographics. Do state what regulatory approval you have if appropriate. What was done in the methods, what was done to address this question? How was it done? How was the data treated, sample sizes, statistical analysis, simple methods. Go on to the results. Present the results in either decreasing order of importance, start with your biggest bang, or chronologically if that makes sense for the type of study you're performing, following the research questions that you presented at the end of the introduction. Avoid figures or tables as the subject or object of sentences as they are not the primary point you're trying to get across. State the major results in the text. Major results deserve text, referring to figures or tables parenthetically as necessary so that you don't have to bog the text down with the specifics of the data. Don't duplicate the data in the text, figures, or tables. There's a limited amount of space, and it's important to just state the concepts and then refer to the figures or tables as necessary. There's typically room for 2 to 3 figures or tables for your most important findings. You can group a couple of bar graphs together, say, as one figure if they go together, and that can help you at submission time. Regarding figures or tables, these are generally the most visual way to present key results, at least in terms of figures. So if you can identify your really important, your key finding or two, you probably want to devote the space and the time to generate a clear figure to show what that was. It's a great way to communicate findings to reviewers who may be pressed for time during the review process. Every reviewer will, although they'll read the abstract for sure, they'll look at the figures. They'll see what is that key result. And if you can impress exciting findings in a key figure, you're well on your way. Tables are a very space-efficient way to present a lot of data. So if you have a lot of quantitative results you want to get across, a table may be the best way to do that. Regarding your discussion, describe how your data support the answers to the research questions or hypothesis. That's really the primary purpose. Establish what's new and important by putting your work in context with the field, comparing your findings to those of others, how they may agree, how may they disagree, and how they tell a story together. And end with a clear statement, for example, the implications of your findings, or with speculations based on the answers to your questions. It's important to have a clear statement at the end that Why do abstracts get rejected? One is that the research question has already been asked and answered, and that's why it's important to perform that new literature review that I talked about before the study begins, so you limit the possibility that the study that you're proposing to do has already been performed. Second likely reason for rejection, the population is insufficient. You're working in patients, but you should have been working in animals. You're working in cadaveric material, but you need to work in live patients, or vice versa. Or you don't have enough. You have too small an N. There may be a fundamental flaw in your methodology. The approach you're using may not be appropriate or sufficiently rigorous for the question you're trying to address. And then sample size is always an issue. Why else can your abstract get rejected? The data obtained does not address the research question. We do see sometimes where the research question is stated very clearly, and then the data that's presented isn't directly relevant. It's on the same topic, of course, but it doesn't really address the research question, and that's something that's being looked for. And then conclusions are sometimes not supported by the data. The conclusion should come from the data that you've obtained. You can speculate, but the conclusion should come from the data. Another reason could be that the research question is not that important. I mentioned at the beginning that it's important to study important questions. You're going to spend your time, energy, resources on the research. You may as well be studying important things. If the work's not deemed to be that important, it may not get accepted. And then finally, poorly written abstracts. There are times when, as a reviewer, you just can't get through the abstract. You can't figure out what's being communicated, and that makes it very, very difficult to be reviewed favorably. So in summary, do your homework prior to initiation of the study, and I can't stress this enough. Make sure everything is set up so you're ready to go before you start the study so that you can complete the study in a scientifically rigorous way. Research high-impact questions. Focus your study and its presentation. Present a clear message. Present a clear hypothesis, the study to address that hypothesis, and then conclude supporting, not supporting whatever you find regarding that hypothesis. And put your work in appropriate context. Refer to the previous work as appropriate and put it in the context of the field. So thank you very much, and I'll turn the microphone over to Dr. Alliston. We'll move on from here.
Thank you, Dr. Kozlowski. Our next speaker is Dr. Tamara Alliston. Dr. Alliston is an associate professor at the University of California, San Francisco, Department of the Orthopedic Surgery, where she leads a laboratory for skeletal cell signaling and differentiation. She is a member of the ORS Board of Directors and the head of the Professional Development Council. She is the past chair of the New Investigator Mentoring Committee, which provides a wide array of professional development opportunities to new investigators in orthopedic research. Dr. Alliston also serves as a faculty member for the New Investigators Mentoring Workshop. Thank you for joining us, Dr. Alliston.
It's my pleasure to be here. Thank you very much. Having a little trouble advancing my slides. One second. Okay. So you just heard some great tips and ideas of how to write a clear and compelling abstract, and also ways to avoid some of the pitfalls. But if you're watching this webinar, you're probably somebody who wants to get that abstract picked for an oral presentation or for a new investigator research award. So what can you do to really set your abstract apart and make your research that you've done shine for the person who's reviewing it? We thought we'd take those ideas that you've just heard and just walk through one of the previously award-winning NIRA abstracts to show you how this was done in a really outstanding study. So first I want to say thank you to Dr. Holstein, who gave us permission to review with you the award-winning abstract, Erythropoietin Improves Bone Repair in Atrophic Non-Unions. And the first thing that you'll notice, the abstract's format varies a little bit from year to year, but even just looking at this from this far-out view, you can see that it's a very aesthetically attractive abstract. We have some nice figures, there's a nice organization of the text, and it's going to be easy for a reviewer to dive into this and spend their time to understand the message. So this has to do with presentation and message. The next thing that you'll notice is the relative allocation of space in this abstract. So first of all, half of the abstract is not given to the introduction. You can see that the introduction is less than 25% of the space that's allocated. Another 25% or so is given for a description of the methods, but the majority of the abstract space is left to the results and the figures. And then there's a small amount additionally that's given to the discussion and significance, a quarter at the end, to put those ideas into perspective. Let's take a closer look. So methods, what is it that you can do in the methods beyond what you've already learned that you need to include that really helps your study stand out? You may not have thought about this, but some of the things that help a study look as rigorous as it actually is and show that this is a study that's ready to be on the podium is information about the sample size and about the significance. So if you have a very complete and rigorously done study, you'll have an N that's impressive. Certainly in this abstract that's the case. There's an N of 38 and 40 in these experimental groups, and there's also information about the statistical significance here with a detailed description of the p-value as well as the statistical tests that were performed. So you can see that these small details really tell us a lot about the quality of your study and provide confidence in the conclusions that you're making. The results, I think we went over most of that. This is really where you're going to be putting forward those ideas. Work hard to think about how to clearly and concisely present those facts in a logical way and include references to the figures. So it's important that if you do include figures, you show where in your abstract those figures are related to the specific data or ideas that you're presenting. All right, so let's talk just a moment about the figures. This is something that's very common in ORS abstracts, and I think it's a bit different from some other from abstracts that you might have submitted to other meetings. It's not required, but it's a nice opportunity for you to highlight your data. So what do you need to do in order to make a really strong figure? The things that work the best, of course, are things that are visually evident. So you can see in Dr. Holstein's abstract that there's a clear difference that you can see between a couple of these panels so that a reviewer can instantly look at this and understand the dramatic nature of these findings. The next thing that's critical is to include a very clear figure legend. So someone who works in the field of bone and fracture repair will understand immediately that these are micro-CT scans, but somebody who's working in a different area may not be familiar with this type of data and might not understand what the green versus the gray represents, and so you can see that in this figure legend there's a clear description of what each of the elements of this figure are. Another common mistake is that people often label the figures with words or notation that is too small to be read in the final format. So do a reality check on your final figures to make sure that this is going to be legible in the final version. All right, so I think one of the most challenging parts in developing a good abstract, especially for newer investigators, is how to set up the question, how to set up and define what that hypothesis is, and what do you include in that introduction out of all of the possible facts that could be in there. Here are a few guidelines that can help you out. And Dr. Holstein's abstract does a great job of illustrating these points, of defining the key terms in those first handful of sentences. So this abstract is about erythropoietin and its effect on fracture healing. And so you can see highlighted here, these are the key terms that are represented in the title and throughout the entire project, and they're each defined in these first 4 or 5 sentences. Importantly, the next thing after that handful of sentences is a statement of the hypothesis, and it actually says, our hypothesis was, so there's no ambiguity. It's very clear for anyone who's reviewing this abstract exactly what they set out to test. The next thing that I really like about this abstract is that those key terms that we highlighted above in that handful of sentences, here they are. Each of them shows up in the abstract hypothesis so that when we finally do get to the hypothesis, we know exactly what we're talking about because it was just defined for us. Now let's talk about the discussion and the significance. How can you make that message come across as clearly as possible? So in this top box, I have copied again the hypothesis statement we just looked at from the introduction, and below is the first sentence of the discussion. in conclusion, the results of the present study demonstrate that. So a great trick that you can implement is to use some of the same words in that hypothesis and in that conclusion statement. So this is why it's so critical that you carefully define what should the hypothesis for this specific abstract be, because you want to be able to, if not answer it, at least provide some insight about what you've learned about that question through your results. So for example, here are some of the same words that were used. They're repeated identically in each of these to address that question. And again, these are the same words that were highlighted and defined in those first set of sentences in the introduction. Another critical point in your discussion and significance is to take advantage of this opportunity to demonstrate how clearly you understand the results that you found. The time that the ORS abstract deadline comes along may be perfectly aligned with you really understanding the phenomenon that you set out to study, and then you want to communicate a very strong level of certainty. You've completed it, you have all of the N, the statistics are complete, you're submitting a manuscript, and then you want to use nice strong words like this study demonstrates. On the other hand, you may have some aspects of your study that are a little less clear at this point, and so you want to be sincere about what you know there as well. So another part of this study wasn't as clear in Dr. Holstein's abstract, so these findings most probably demonstrate. So you can show both the strength as well as the areas that may need additional study with your word choice in the discussion. Again, placing your work into scientific context, that's especially important so that people reviewing your work understand what was the gap in the field that you set out to address and how did your work fill it. All right, so now that we've gone over some of the basic ideas of writing a great abstract and some of the ways that you can work to set your abstract apart from others so it can be recognized, let's talk a little bit about the logistics. How do you get this abstract submitted? Well, it's really pretty straightforward, but here are just an overview of what you need to do. You go to the abstract submission site on the ORS website, and you click on the annual meeting link for the current annual meeting, and then follow through that to find the call for abstracts. And in my experience, that's always been a pretty easy thing to find. Importantly, you want to pay attention to that submission deadline. It's a good idea to know what that is plenty of time in advance so that you can make sure that abstract has a chance to be reviewed by others in your lab for critical input, of course, your PI, as well as all of your co-authors. And that's an important one to consider. I can't tell you how many times I've got an abstract to review just a short time before the abstract submission deadline. So that's a professional courtesy you need to give to your co-authors. The submission closes at 5 p.m. Central Time on the submission deadline date. So that's an important thing to remember. It's not midnight. You need to pay attention to whatever time zone you're in when you're submitting this abstract. The ORS call for abstracts page also has some very useful documents. So there's a frequently asked questions document as well as submission instructions for authors. And I know that folks at ORS are also happy to help field questions in case you get stuck. The submission process requires that you have the contact information for the presenter as well as some relevant information about each of your co-authors. So you'll need the emails, affiliations, and disclosures for each of your colleagues who are co-authors on your study. Start early. It always takes longer than you think, and you don't want to be rushing literally the last minute to try to get this submitted. It's too important to leave to that last minute time frame. So once you've submitted your abstract, there's an opportunity for you to review all of the information that you provide through the submission website. Make sure you review it, take a final opportunity to proofread your work. Make sure that all of the sections of the submission site are completed. So in addition to just pasting your abstract in and putting in your name and title and so on, there are a variety of other pieces of information that you need to provide, such as keywords and so on. So you want to make sure you get all of that information in there. When you're finally done, you'll see a web page that confirms that your submission is completed after you've finished with the payment step as well. So that will give you a control ID number, and you want to keep track of that just in case anything gets lost in the shuffle. Finally, there's a link on the page, the final page, that confirms your submission. And it allows you to send an email confirmation of your submission to yourself as well as to your co-authors, so that everybody who's participated in the study has an opportunity to see the final version that was submitted and keep it for their records, so that they can show their contributions to this project. All right, now that abstract is submitted and it's out of your hands for a while, what happens next? So the review process requires volunteers from the ORS members who serve as expert reviewers in their field. So each abstract that's submitted to the ORS gets reviewed and scored by each of 4 different reviewers. And there's a lot of care given to doing whatever possible to remove conflicts of interest. Specifically, the reviewers are blind to the authors and to the affiliations of the people who've submitted the abstract. And if any conflict of interest arises throughout the review process that may not have been anticipated up front, then reviewers are disclosed that they have a conflict and their abstract is reassigned to new reviewers. How are those reviewers for your abstract assigned in the first place? The reviewers are selected based on the first 3 keywords that you provide when you're submitting your abstract. So the selection of those keywords is clearly very essential to making sure that your abstract is reviewed by people who understand the importance of your work. And the order of the keywords is also important. So the first one will be the first thing that helps define who your reviewer is. So be careful in selecting the keywords and put them in the correct order so that you'll get the right reviewers for your project. The reviewers are asked to score each of the abstracts on a scale of 1 to 5, with the score of 1 being reserved for abstracts that are truly superior. Good gets a score of 2, acceptable a score of 3, marginal 4, and poor is 5. If a reviewer decides to rate an abstract with a score of 4 or 5, there is a comment box that they're required to complete that says specifically why there was a concern about this abstract. And importantly, if after the scores are returned, the topic chairs and program committee will actually review any abstract that receives a score of 4 or 5 and read those text submissions to really understand what was going on with that abstract. On the other end of the scale, abstracts that score in the 1 to 2 range are selected for podium presentations, and abstracts that are scored in the 2 to 3 range are assigned for posters, as well as any higher scoring abstracts where the authors requested to present a poster instead of an oral presentation. So just summarizing what we've talked about today, nothing can make up for research that isn't carefully considered and scientifically rigorous. So picking your critical, important, and timely research question and doing a beautiful study that is rigorous to address it and generates compelling data is the very best way to have an outstanding ORS abstract. And once you have that, think carefully about how to state and define that hypothesis for the abstract specifically, and carefully present the rationale so that people can understand your hypothesis as well as understand the answer as you deliver the message of your abstract. Finally, take care to give careful consideration to the way you write the abstract. Take the time to present attractive figures, and do that professional last step of making a polished and proofread documents that all of you and your co-authors are very proud to have shown at the ORS. Finally, this webinar is really intended to give our new investigators an opportunity to think about representing themselves to the scientific community through these abstracts. But that's not the only way. There are also opportunities provided through the annual meeting and other things that occur throughout the year to advance new investigators' career development. So I encourage you to take a look at the website and learn about all of the other new investigator mentoring opportunities to help you advance your career as an orthopedic scientist. Thank you very much.
Thank you, Dr. Elliston. I just want to remind you again, if you have any questions following this presentation, please send them to the ORS at ors.org and we will respond. I'd just like to add that it is very easy, as Dr. Alliston mentioned. Once you go to the ORS annual meeting, the ORS website, then the annual meeting page, there is a call for abstracts page, which is open during the 2 months of the year that the call for abstracts submission is going on. That page has detailed information on submitting your abstract, the link to the online system, the open and close date for submissions, along with some other documents that are very helpful for the submitter. In addition, there's also another page that can be printed out, which includes it's a printout of every page of the submission during the submission steps with notes written on them that are helpful for new authors that are submitting, and also if you have someone in your office who is submitting on your behalf, and they can collect information from the authors, have it all written down on those printed pages as they start entering the submission. So please do refer to the Call for Abstracts page for all the information to help you complete your submission, as well as to be aware of the deadline date. As Dr. Alliston mentioned, we do have other information for mentors on the ORS website. Again, if you have any questions on that, please do not hesitate to contact the ORS directly by phone or by email. I'd like to thank again both Drs. Kozlowski and Alliston for sharing their insight and expertise with us today. This will conclude Best Foot Forward Writing Compelling ORS Abstract webinar that we've had today. Thank you.